In the top stories, CPL 2021 tournament to be held in St. Kitts and Nevis. Fully vaccinated persons still need to present COVID test in Guyana, and U.S. to share 60 million COVID vaccines to needy countries. Hello and welcome to the ZIZ Midday Newscast. Today is Tuesday, April 27, 2021. I'm Jason Davis. Nationally, the entire 2021 Caribbean Premier League or CPL T20 tournament will be played in St. Kitts. The announcement was made during a virtual press conference on Tuesday by the Minister of Sport, the Honorable Jonell Powell.
My pleasing duty to announce that yesterday, the Federal Cabinet of St. Kitts and Nevis approved the hosting of the entire 2021 CPL tournament here in St. Kitts and Nevis to be held at Warner Park in Bastia, St. Kitts.
Minister Powell also announced that as of May 15, once they're fully vaccinated, patrons will be allowed to attend all sporting events at 50% capacity at the venue. CEO of the CPL tournament, Pete Russell, noted that the tournament ensures that the host country gets an economic boost through its wide reach in the region and around the world.
One of the key things for us is always to ensure that the local economy gets a boost, because we've proven over the years that when CPL is in the region, we're able to do that, both in terms of actually spending money within the region, but also in terms of highlighting the region around the world. Last year, we were broadcast to over 520 million viewers globally, which is a phenomenal achievement.
The first match is slated for Saturday, August 28, and all 33 matches will be played at the Warner Park Cricket Stadium in St. Kitts. The Department of Environment, in collaboration with the United Nations Environment UNEP-DTU Partnership and its regional collaborating center, the University of the West Indies, recently launched the preparation of a technology needs assessment for St. Kitts and Nevis. The stakeholder consultation, which took place on Thursday, April 22, saw a wide array of disciplines participating in the exercise. The stakeholders from both the public and private sectors participated in this activity, which also served as the official national launch of the TNA project. Through a series of stakeholder consultations, the project will identify and prioritize at least 4 appropriate technologies in water and agriculture under adaptation and energy and transport under mitigation. The TNA process is a stakeholder-driven process that will require the involvement and support of everyone, according to a statement. The statement continued, "It will position us as a people to create a pipeline of additional programs and projects with the plan to target various financial sources for implementation." World Immunization Week will be the topic of discussion on this evening's edition of Leadership Matters. Prime Minister Dr. the Honorable Timothy Harris will be joined by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff at the Joseph N. France General Hospital Dr. Cameron Wilkinson, and CEO of the St. Kitts Tourism Authority Raquel Brown. World Immunization Week is taking place from April 24 to 30. Leadership Matters, which begins at 8 p.m., simulcasts on ZIZ Radio and other participating radio stations. It's also streamed live on social media platforms, including the Facebook and YouTube pages of ZIZ and the SKNIS, the St. Kitts Nevis Information Service. Moving to news on the regional scene, as Guyana continues its mad dash to vaccinate its way out of the pandemic, it maintains that fully inoculated persons will still have to be tested for the disease when entering and leaving the country. More in this report from Tamika Rodney.
Requirement will remain in place since none of the COVID-19 vaccines provide full protection against the disease.
Being fully vaccinated, whether with Pfizer, Moderna, Johnson & Johnson vaccine or any other vaccine, there is still a risk that you can get infected.
The United States Center for Disease Control and Prevention on April 2nd advised that fully vaccinated people can resume domestic travel and do not need to get tested before or after travel or self-quarantine after travel. The CDC also indicated that a person is considered fully vaccinated 2 weeks after their second dose in a 2-dose series, such as Pfizer or Moderna vaccines, or 2 weeks after a single-dose vaccine, such as Johnson & Johnson's vaccine. However, for Ghana, the health minister has announced that persons are fully immunized 7 days after the second dose. Amid the inoculation of hundreds of persons daily, there has been an exponential rise in new infections. Amidst a record-breaking 240 new infections reported on Friday last to over 1,500 patients currently on home isolation and 287 COVID-19 related deaths to date, the Ministry of Health has managed to administer 121,237 first doses of a COVID-19 vaccine to persons, in addition to a number of second doses.
For second doses, we had approximately 2,135, I think it was, for the second dose.
Tamika Rodney reporting for the HGP Nightly News.
A student at a school in the south of St. Lucia has tested positive for COVID-19. This comes 1 full week after school was officially reopened for the third term. More in this report.
Put in place for this eventuality. Sources tell News Force that a student at the Labrie Boys Primary School has contracted the virus, and a class of 16 students has been asked to quarantine as they await test results. The education sector has been among the hardest hit in the ongoing COVID-19 pandemic, disrupting physical classes and causing grave financial woes to some administrators and staff. While Chief Education Officer Dr. Fiona Philip Meyer did not speak specifically to reports about a confirmed case, she highlighted the challenges facing the school system like any other sector given exposure to the community amid a pandemic.
For us, we are cognizant of the fact that we are part of a larger society. I like to say education is not a bubble. We would have parents, students, teachers, other staff members who may be impacted by COVID. The reality is that we have to manage COVID cases as per all other sectors. Having looked at the statistics and seen the number of cases which is in the adult population, we would note that many of these adults are parents, are staff members, and so it will be a situation where we have to manage cases within educational institutions.
It should be noted that health officials have labeled schools as low-spread areas. The education sector is governed by a rigid process that includes sanitization at points of entry, physical distancing, and alternate day scheduling of classes to avoid overcrowding at the school plants.
It is about working with the health authorities, working with our teams on the ground to manage as best as we can, with hopefully a consistent period for our students to be within educational institutions.
It is also noteworthy that given the low risk of spread at school, the threat of cases often emanates from outside the school population through sources like transportation, community and adult spread. Dr. Philip Meyer outlines the measures implemented to mitigate pandemic disruptions to the vital third term.
Knowing that, there are incidents where we will have to manage COVID-19 cases, and so all established protocols should be in place and are in place. And our big reminder to everyone is to adhere to the protocols at education institutions as well as in the wider population and the wider general public.
Data from the World Health Organization suggests that children under the age of 18 years represent about 8.5% of reported cases. WHO has recommended that after reopening schools, a rigid monitoring system should be in place to identify the number of school-based outbreaks effectiveness of policies and measures, and effectiveness of symptoms reporting, testing, and contact tracing of suspected cases. According to the WHO, lessons learned from the monitoring exercises should be employed to ensure the safest environment possible for students and staff. Solange Alfred, HCS News Force.
Internationally, the United States has announced it will send up to 60 million doses of the AstraZeneca vaccine to needy countries, including India, which is facing an unprecedented surge in coronavirus cases. President Joe Biden called Indian Prime Minister Narendra Modi and pledged to provide emergency assistance. The international community has criticized the U.S. for hoarding its vaccine supplies. Al Jazeera's Kimberly Halkett reports.
Suffering of COVID-19 patients in India, we've identified rapid.
Under pressure from global governments to do more to help fight COVID-19, the United States is sending much-needed medical supplies to India.
There are a number of areas that are of great interest and are of great need to India at this point in time. Oxygen is one of them. At India's request, we are exploring options to provide oxygen and related supplies. We've identified U.S. commercial suppliers of remdesivir that are immediately available to help relieve the suffering of COVID-19 patients in India. We've identified rapid diagnostic testing supplies, personal protective equipment, and additional ventilators.
On Monday, U.S. President Biden called India's Prime Minister Modi to discuss how the two countries can work together to protect their populations. India is experiencing one of the worst COVID-19 outbreaks the world has ever seen, and oxygen supplies are short. The U.S. and other developed nations have been under criticism for stockpiling vaccine doses while poor countries struggle. After weeks of hesitation, the U.S. now says it will assist India in boosting its vaccine supply. 53% of the U.S. population has received at least one vaccine dose of the Moderna, Pfizer, or Johnson & Johnson vaccines, and appointments are now easy to obtain. But vaccines from America's AstraZeneca stockpile have not yet been approved in the U.S. Still, the Biden administration will now make up to 60 million doses available for export to countries like India, following a government review.
Before any AstraZeneca doses are shipped from the United States, the FDA will confirm any such doses meet its expectations for product quality.
The U.S. is also sending a team of experts from the Centers for Disease Control to help India manage its crisis. The U.S. actions are reciprocal. India sent the United States assistance in the early days of the pandemic when the U.S. was hard hit. Now the Biden administration wants to return the favor. Medical professionals say the U.S. move is a good start, but more must be done.
What's needed in the long term is quite clear: a waiver of all intellectual property patents that control or that hinder global distribution of the COVID vaccines and other COVID-related technologies.
As India battles its COVID crisis, some countries and airlines have banned flights to and from India. But the White House says it has no plans to ban travelers from India to the United States. Kimberly Halkett, Al Jazeera, the White House.
And now for the weather. Present conditions are fair skies with a gentle breeze of 10 miles per hour from a southeasterly direction. The temperature is 30 degrees Celsius or 86 degrees Fahrenheit. Seas are moderate with waves of 4 to 6 feet. The weather forecast for St. Kitts and Nevis says today and tonight will be partly cloudy with a 20% or slight chance of showers. Sunset today will be at 6:30 p.m., sunrise tomorrow at 5:48 a.m. And that brings us to the end of the ZIZ Midday newscast. Join us this evening for these stories and more in detail. Thank you for tuning in. I'm Jason Davis.